In June of 2012, Dr. Ellen Sachs gives a TED Talk about her trials in dealing with chronic schizophrenia. She tells her side of the story about what it is like for a patient in a psychiatric hospital, and it gives listeners a deeper insight as to what it is like to be a psych patient, saying, "Imagine having a nightmare while you are asleep." Her stories like this one allow the audience to better understand what she and many others have gone through. Mental health is something that is just as important as our physical health, if not even more important. Everyone at some point in their life will deal with being mentally ill, whether that be depression, bipolar disorder, or even schizophrenia, like Dr. Sachs. It is not bad or weird or attention-seeking to need help for these issues, and being afraid of the treatment centers is a large reason why people don't go seek help for their mental health. This is a topic that more people need to be educated about so they can reduce the stigma about the hospitals and mental health as a whole. I have always been very interested in abnormal psychology since back when I was a junior in high school, and I have had the privilege of working while still in college at a local hospital on one of the 2 adult psychiatry floors. I work with mental health patients on a daily basis, and I have a fairly good understanding of what it's like when they're in the hospitals. Today, first, I want to clear up why people are admitted into mental health hospitals and become patients there. Second, I'm going to describe what it's like on a daily basis within the mental hospital in which I work. And finally, I'm going to describe the many different safety precautions that are put in place in order to keep patients, staff, and visitors safe while on the unit. So first, let me tell you more about why a person might be admitted into a psychiatric hospital. On a daily basis, people just like you and I are admitted into the hospital. In Dr. Sachs's case, she has chronic schizophrenia and might have experienced a relapse and is in a state of psychosis, but that is not necessarily the case for every single patient that is admitted. One of the most common reasons that patients end up in the psych hospital is because they're dealing with depression and they need to get their medication sorted out through seeing their psychiatrist. Secondly, children are admitted as well as different adolescents because they have different issues in disobedience with their parents or mood disorders. That's something that not many people realize is a psychiatric issue. As well as suicide is very prevalent in today's society, and many people on a daily basis have thoughts of committing suicide or harming themselves, and that is a reason why they might be sent over to a psychiatric hospital in order to ensure their safety and to get them back on a different track of thinking. Now that we've looked at why someone is admitted into the hospital, we have a better understanding of the different diagnoses that go on and that they're not all psychosis. Let's discuss what it's like on a daily basis on a psychiatric unit. As I said before, I think most people have a fairly skewed idea of what it's like to be on a psychiatric floor on a daily basis. I think a lot of people view it as something similar to a jail where patients are locked up. Everyone is crazy and delusional. It's dangerous and scary, when in reality that's not what it's like. Patients feel comfortable with admitting themselves a lot of times to these units for many different reasons. Some examples are that there are a lot of different support systems to utilize while you are on a psychiatric unit. There are round-the-clock technicians like myself, as well as registered nurses that are staffed on the unit. The nurses are there to administer medications, to assess each patient and see how they're doing each day. Technicians like myself spend the majority of the time with the patients. We give them activities to do, someone to talk to, and we ensure safety. So they're not just sitting in their room by themselves. In fact, the program at the hospital that I work at, they actually are closed out of their rooms for the majority of the day, other than, mornings and nights when they are asleep, and an allotted nap time during the day, unless ordered by a doctor, whereas we instruct a program throughout the day so they are awake and socializing with other people and getting to talk about the things that are actually on their mind and bothering them. Aside from the technicians and the registered nurses that are constantly on the unit, there are also psychiatrists, psychologists, recreational therapists, and social workers that work hands-on with each patient. Each patient will see a psychiatrist every single day. The rec therapists are there daily to do recreational groups, and a social worker visits with each patient. Each one is assigned to a different staff member. With the staffing members, we put on a multitude of different programs throughout the day. The rec therapists do more recreational activities like painting, listening to music, playing the Xbox or Kinect, puzzles, different board games, different things like that, in order to influence more fun activities as opposed to sitting and thinking about the depression that they're dealing with. And then technicians like myself, as well as the psychologists, put on directed cognitive groups in which it gets the patients thinking about their current situation and how they might be able to change it, or where their thinking has gone wrong, or different addictions that they're struggling with that might not be helping their situation. As you can see, we try very hard to provide a positive and secure atmosphere for these patients. And so next I will explain the different safety precautions in order to keep them safe. I think a lot of people can be very intimidated by the idea of a psychiatric facility, but it is not intended to be intimidating. We want the patients and the people visiting, as well as the staff, to feel safe and secure and protected, as well as open and a completely sharing environment. There are many different levels of security to the different kinds of psychiatric facilities. Mine personally at the hospital is a fully locked facility. So with this, we have our ID badges, which are obviously put in place in order to identify ourselves so patients and others know our name as well as with a face. But those ID badges have a second purpose in which they scan and unlock a multitude of the doors, including the ones to enter the facility as well as to get into different main doors onto different hallways. And then staff is also equipped with a set of keys that gets into closets and different rooms like the group room where we hold those cognitive groups. The Sally Port doors are a way to enter and exit the facility. You cannot exit one without the other one shutting. So that's a way to ensure that no patient is able to escape if they try. As well as when a patient is admitted, staff members go through their belongings in an inventory style, and there are specific restrictions on what clothes patients are allowed to wear of their own on the unit. As for example, they cannot have one that has a hood as well as strings to prevent harm to themselves, and then we remove any sharp objects or cell phones that could be seen as a distraction. I have had to explain to many people on a daily basis what it is like to actually work on a psychiatric facility, and I think a lot of people are shocked by the normalcy of it. First, today I explained why different patients are admitted, and second, what it's like to live on a psychiatric unit for a week as you are admitted, on what it's like each day. And finally, I talked about the many different safety precautions that are there to ensure people's safety. So hopefully now others are able to have a better understanding of what the reality is of mental health and the facilities that you might check yourself into in order to improve that mental health, and that people will realize that it's okay to be depressed and it's okay to have bipolar disorder or even schizophrenia, and that there are many different facilities out there trained to help you, and that it's okay, and we're there to help you when you need it. Thank you very much.